Okay, blood pressure video. So prior to coming to the resident's room, I washed my hands and I gathered the blood pressure equipment that I need in order to successfully take the blood pressure. So I'm knocking, I'm pausing before I enter, I'm coming in, I'm introducing myself that I'm a student CNA and that I'll be taking the resident's blood pressure. I'm addressing the resident by proper title, asking if that is what they would like to be called. I'm checking for forms of identification via the wristband, asking for full name and birthday, or by a facial picture at the nurse's station in the resident's chart. I need to make sure that I'm treating the appropriate resident. If any visitors are in the room, I'm going to politely ask them to leave unless it is a resident's wish that they remain in the room. I'm closing the hallway door for privacy and I'm pulling the draw curtains all the way around. And prior to taking the blood pressure, I needed to communicate with the nurse if there were any dialysis ports or IVs, injured arm, any cast, because I cannot take blood pressure on that arm. If it was a woman, I would make sure that there was no history or signs of breast cancer, because I cannot take blood pressure on that arm of the injury. So I need to make sure that the resident is properly sitting down or lying down for 10 to 20 minutes. If sitting up, be flat and palm will be up. I had to select the appropriate size cup and turn down the TV or any radio. I don't want any sounds interfering with my reading. Resident is safe, and I have all my equipment on a clean bedside table. If it wasn't clean, I have a barrier to protect the equipment. So I would explain the procedure step by step. My resident is sitting. I'm going to ask if you have your palm faced up. Yep. Can never take it over the bare arm, so I'm going to lift your shirt up. I am placing the blood pressure cuff, which is the appropriate size for the resident, over the brachial artery about 1 inch above the elbow, and it's properly lined up. I am cleaning the stethoscope earpieces and discarding. I'm using my fingers, not my thumb, because my thumb could interfere with the reading. Placing it over the brachial artery. And that's 118 over 90. How you feeling, okay?
Yes, ma'am.
Cleaning the earpieces. No pad and paper. I'm writing the resident's name. 118 over 90. The first number I heard was systolic, and that is between 90 and 120 is a normal range for systolic, and diastolic is the last number that I heard, and that normal range is 60 to 80. If any of the ranges are out of normal, that I would wait and immediately tell the nurse, or if I couldn't hear, wait 1 minute if I'm taking the blood pressure on the same arm. Closing tasks, I would make sure the resident is properly safe, either in the wheelchair with the brakes locked and the call light attached, or back in the bed at its lowest position with the call light attached, or the safest position. I would pull the draw curtains back, ask the visitors to come back in. I would do a safety check of the room. I would wash my hands and then again clean the equipment that I used to perform the blood pressure on the resident, and that is it.